I have Courtney with me today, and we're going to be examining the eyes and looking over the eyes. So first what I'm going to be doing is I'm just observing here. I'm looking at the eyes, making sure there's no ptosis, no ectropion or entropion. We're also looking at the conjunctiva, making sure there's no pus, any maybe possible bilirubin or jaundice due to jaundice. Maybe also looking for any blood vessels are ruptured or any redness or swelling or excessive tears or dried tears on the eyes. Everything looks great. So next we are going to do, and I'm also looking and noticing that she's blinking normally, and that's working well. So next we're going to do is I'm going to look at her eyelid, and we're just going to make sure that it's a normal red color, getting good blood flow. If it wasn't, it'd be due to anemia, or if it's looking yellow, could be due to jaundice. Good, that looks normal. And that looks normal as well. Next, we're going to palpate the lacrimal gland and the lacrimal sac. So let me know if there's any pain or discomfort with this. And this is the outer portion of the eyebrow. And then we're going to the lacrimal sac. Any pain with that?
Nope, I'm normal.
Good. Okay. So now that that's good, we're going to go and I'm going to look at the side of her eye to look at the cornea. And just making sure it's clear, translucent, no scratches or any irritation or defect. Next, we're going to look at the corneal light reflection. So I'm going to shine the light right on her glabella, looking at the light reflection in her pupil. It's normal. It should be medial in the middle of the pupil towards the nose or midline, which it is. It's normal. Next we're gonna do perla, which is pupils equal, round, react to light, and they accommodate. So that's what we're going to be assessing right now. So next what we'll do is I'll have the patient look at the pen tip, and they constrict as they look, and I'm going to tell her to look past me off to the distance, and they dilate as she looks past, which is what they should be doing, which is normal. Next, I'm going to have her track in an H pattern to make sure the eyes are moving correctly and they're not lagging as well. Also, prior to this, I'm also looking for strabismus, which would be an eye wandering or drifting, which is not present. But I'll go back to the tracking now. So I'm going to start in the middle. Again, just smooth flow of the eyes following the H pattern. Coming back to the middle. Perfect. And that worked. That was great. It was smooth. There was no issues. Next, we're going to do is we're going to look at the reaction to light and the accommodation. So I'm going to separate. I'm just going to come a little bit closer. I'm going to separate, making sure. I'm going to have you move just a hair. Perfect. I'm going to separate the eyes, making sure the eye that I shine a light accommodates. Then I will do it again, looking at the opposite eye, making sure even though that light isn't getting the eye, it should accommodate and constrict. Good. That was normal on the right eye. Now I'm going to look at the left eye. Good, and that constricted as well. For the purpose of the exam, I would go around to the next side and do the same thing on the opposite eye. Shine the light in the left eye to constrict, and as well looking in the right eye while the light is in the left eye as it should constrict. Next, what we're going to do is we're going to look for a type of strabismus, which is known as tropia, which is a small variation or a small deviation of the eye or lagging of the eye. So I'm going to have her look at the pen here. I'm going to cover one eye and quickly remove it away. Good, and that's normal. I'm going to do the other eye as well. Good, and that's normal as well. She does not have any symptoms for that. Next, we're going to do visual fields. So I'm going to come behind her. I'm going to tell her to look straight ahead, and I want you to lift up the arm to the side that you see first. If you see them at both at the same time, lift them both up. If one comes before the other, just make sure you lift the first one that you see. Okay. Good. 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 And that's everything. Everything.